So we're standing in the operating room at the Surgery Center of Leawood, and I'd like to talk about anesthesia because there are different types of anesthetic. The traditional type of anesthesia is called general endotracheal anesthesia, and that means that the patient is asleep. They've got a tube down their trachea. They're on a ventilator, which is breathing for them, and their muscles are paralyzed, and they're given gas. Now, that type of anesthetic is suitable for a wide range of procedures. For example, if you have your gallbladder removed, that's the type of anesthetic that you'll get. Now, for cosmetic surgery, you actually don't need to have that particular type of anesthetic. We do virtually all of our cases under what's called total IV anesthesia. And that means that patients are asleep, but the medication is delivered using an IV. They're not on a ventilator. They don't have an endotracheal tube. There's no gas. And importantly, they're not paralyzed. Now, why is that important? Well, a couple of reasons. One is that we think that it reduces the risk of blood clots after surgery if patients are not paralyzed. The other reason is patients often ask, can I wake up during surgery? Well, with this type of anesthetic, it's really not possible because patients are never paralyzed. So if they started to wake up, we'd know. They start moving. So there's never a situation where a patient would wake up during surgery. So this type of anesthetic is a very safe type. Patients wake up very quickly after surgery, and they feel better after surgery because they are much less likely to feel nauseous because there's no gas. It's actually called propofol, it's the medication that we use for this type of outpatient anesthesia. And it allows us to do all of our cases as outpatients. After surgery, patients go to the recovery room. They're typically in the recovery room for maybe an hour after surgery, and then they're ready to go home, and we see them the next day in the office.